Town hall that is being conducted by the WHO Civil Society Task Force in the presence of WHO leadership. And I understand we have about 500 people who are joining us from around the globe. So we're very, very delighted to welcome you. I acknowledge WHO leadership in this town hall. Dr. Tedros, the Director General of WHO, I can never forget his words. He said, recognizing the value of transformating power of civil society and communities to drive change for impact. And this is something that I keep in mind as my responsibility to do what I do. And DG has been supportive of civil society like we have never seen before. This we feel as the CSTF is a new era in us working together for opening the doors, for creating space at the table. And we are delighted that he is here with us today as an example. I also want to recognize Dr. Ren, another friend of civil society, I'd like to say, always supportive, the ADG of WHO, very supportive, always there for us, encouraging us. I also recognize Dr. Teresa Kaseva, a very dear friend of civil society and communities, the director of the Global TB program, always there to help us and support us in taking this forward. And we are delighted that they are here to endorse the civil society and communities in this town hall. We are really honored to have you all here with us. Thank you for being here. I'd like to now invite my colleagues, the Civil Society Task Force, to quickly introduce yourselves, your name and your country, so that friends joining us virtually will know who we are.
Thank you, Blessy. Thank you, Didi. Bertrand Campoer. I'm from Cameroon, regional coordinator of Draft TB, Western Central Africa. Thank you.
My name is Chumran. I'm from Cambodia. I'm the executive director of a local NGO called Khmer HIV/AIDS NGO Alliance, but also a chair of the steering committee of all health NGO in Cambodia. Thank you.
Good morning, good afternoon, and good evening, everyone, and those who are connected online. My name is Jeffrey Akaba, Senior Program Officer from APCASO. We are a regional network of community health organizations working on HIV, on health, human rights, and social justice. And I'm also the coordinator of Activists Coalition on TB Asia Pacific. Thank you.
Good. Hello, everybody. My name is Harry Hausler. I'm from South Africa. I'm the CEO of TB HIV Care, the chair of the TB Prevention Task Team of the TB Think Tank, and on the South African National AIDS Council TB Technical Working Group and the Civil Society Forum TB Task Team. Thank you.
Hello, everyone. My name is Yulia Chorna. I'm from Ukraine and Canada. I'm a TB activist and graduate student in social anthropology.
Good morning, good afternoon, everyone. My name is Ezio Távora. I come from Rio de Janeiro, member of the Brazilian TB Research Network, and I'm a community engagement project coordinator for many studies. Thank you.
Hello everyone, my name is Paransari Winarni. I'm from Indonesia and I'm from PETA, patient organization based on Jakarta. Thank you.
Good morning, good afternoon, good evening everyone. I'm Roger Paul Kamgasa from Uganda, Executive Director of Komboresa Africa, which is an advocacy NGO. I'm also part of the WHO Journalist Media Team. Then I'm editor-in-chief of the Harris Times Africa, very passionate about TB and an activist. Thank you very much.
I'm Amir Khan from Pakistan. I'm heading an NGO which has been working with multiple disease control programs, including TB control program in Pakistan.
Hello, my name is Nyang Wim Phu. I'm the technical and money advisor from World Vision Foundation of Thailand. We are working for the migrants population in Thailand, and also I'm the country focal point for the cross-border for the system among the GMS country. Thank you.
Hello, everyone. My name is Jamila Ismailova. I'm from Tajikistan, from Central Asia. I'm the gender and community engagement advisor, TB activist, TB expert. And I'm representing at the Civil Society Task Force. I'm representing the WHO European region.
Hello, everyone. My name is Tenzin Kunor from the United States. I'm with We Are TB, a survivor-led advocacy and support organization. Thank you.
Greetings. My name is Evelyn Kibuchi from Kenya. I'm the Chief National Coordinator, Stop TB Partnership Kenya, and I'm also the Chair African TB Partners Forum. Thank you.
Thank you very much. And my name is Blessina Kumar. I'm also member of the Civil Society Task Force based in India, working globally. Now it's my honor and privilege to invite Dr. Tedros, the Director General of WHO, to deliver the opening remarks. Dr. Tedros, please.
Thank you, Blessina. Dear colleagues and friends, good afternoon and a warm welcome to this town hall co-led by the WHO Civil Society Task Force on TB, which I'm proud to call my friends and colleagues. As you know, the COVID-19 pandemic has reversed years of progress against TB, while conflicts around the world have badly disrupted essential health services, including for TB. For the first time in over a decade, WHO has reported an increase in TB deaths, and this is tragic. This makes meaningful engagement with affected communities and civil society more important than ever. That's why we're establishing the WHO Civil Society Commission, and engaged communities are a critical part of every country's journey towards universal health coverage. TB, as we all know, is an ancient disease that persists as the result of poverty and unhealthy living conditions. It's also a disease that carries a heavy burden of stigma. This makes the partnership between affected communities and health systems all the more important. That's why in 2018, we established the WHO Civil Society Task Force on TB to help bring the voices of affected communities and civil society to the work of WHO. Today, we will discuss the priorities and work of the task force as we look towards the UN high-level meeting on TB in 2023. We also want to hear your views about critical areas where WHO needs to focus its attention in our engagement with civil society and affected communities. We want to make sure we're doing everything we can to put affected communities at the center of our work. Thank you all once again for your commitment to the fight against TB. We face a formidable challenge, but with close partnership between communities, governments, civil society, and WHO, I believe we can raise the dream to end TB. Thank you so much.
Indeed, thank you so much, Dr. Tedros, for reiterating the valuable partnership that exists between civil society, communities, governments, and WHO. We thank you for that. And thank you also for your inspiring words that push us to do more at the ground level to save lives and ensure care and support to people who need it most. I'd like to now request you, Dr. Tedros, to just launch the CSTF report. I believe it is on the table with you. Just if you could launch it.
Okay.
Maybe say a few words.
No, first of all, I'm very glad that we have met in person for the first time, actually, in 2 years and a half. And I'm very glad to see our partnership growing stronger. I remember the early days in 2017, November in Moscow, when our discussion was so heated.
Yes.
And I could see the gaps between us. We were really far apart. And I remember the proactive role you play in really starting a very good partnership. And we have made, of course, good progress since then. We're working together. But at the same time, I believe that we have still a lot to do, and look forward to working with you very, very closely at all levels of our organization, and take our partnership to even higher level. There are many important areas that we will work together. One of the areas being the 2023, the high-level meeting. We should make it a success by starting immediately to prepare for that. But at the same time, we need to use that opportunity to increase the awareness in the world, to increase investment in new TB vaccines, and also in other investments to fight TB better. So thank you so much again for this report. Very glad to have this report, and very honored also to launch it. So thank you so much, Blessina.
Thank you. Thank you. Could I request everyone to hold up the report so that we could quickly have a... Dr. Ren, do you not have a report? We'll hold it.
Thank you. You always put together.
Just hold it up, colleagues. Can we ask you to turn this way and say any? Thank you very much. I would like to now invite Dr. Teresa, Director of GTP program, to provide an overview of your engagement with the civil society, and to talk a little bit about the highlights, and the engagement with the Director General WHO, and also the joint statement. Thank you very much.
Thank you very much. I'm also very excited first to sit next to my two bosses, and also to be together with all of you. And I must say that this is one of the most exciting journeys during my professional career. I also remember very well the beginning and where we are today. And it's a very inspiring example how we can build effective, successful, and friendly partnerships. So with this, I would like to present few slides showing the history, and to present clear example of meaningful engagement of civil society members in WHO core business, and how we are planning to move forward. Okay, trying to maybe. Okay, so again, would like to echo Dr. Tedros and to remind that TB remains one of the biggest infectious disease killer right after COVID-19, but unfortunately with not with that level of prioritization, investments, and attention. And with your support, we hope that we will be able to attract necessary attention and investments. Out of almost 10 million people who fell ill with TB last year, more than 4 million people didn't receive, unfortunately, access to life-saving TB prevention, diagnosis, and treatment. And due to COVID, of course, 19, but not only, it means that we should double and triple our efforts. We had very ambitious high-level meeting targets: 40 million people to treat for 5 years, 30 million people to provide by preventive treatment. But these targets are not on track. We've been pushed back. But in the same time, we can see in even in high TB burden countries where they have necessary attention and prioritization, that progress is possible. And they've made this progress and reached our 2020 anti-TB strategy milestones. Our journey started, our journey and new era in the relationships with the civil society, as Dr. Tedros mentioned, started in 2017, and we can't even believe how dramatically the whole story of our collaboration has changed. And I would like to use this opportunity and once again to thank you. I would like briefly remind about WHO role in ending TB, in leading global efforts. Of course, our vision is world free of TB, and it's possible because TB is a preventable and curable disease, and we have now much better opportunities and looking forward for new effective vaccines. We are leading and guiding global efforts, and our core role and functions are well known. We are developing and promoting guidelines and recommendations, setting norms and standards, shaping the TB research and innovations agenda. We are ensuring provision of technical support to the member states. We are monitoring TB epidemic. And in all these efforts, role of civil society is absolutely key, and you are real drivers of all these processes. And we know it because we've tried to engage literally in all these key areas, our colleagues and partners from civil society and affected communities. Here you can see examples of our 2 reports. This is already the second one where we try to summarize our achievements, joint achievement, and first of all, your work, not only at headquarters level, but also at the regional and country level. But we know that we can do more. We have unique examples of joint initiative with the Director General and joint statements. And now we've heard another commitments that this work will be continued. A few more examples from our core work development of the guidelines. We've dramatically updated for the past few years all our core guidelines, and civil society task force members were involved literally in all of these processes with meaningful contribution. One of the recent examples of one of the most important updates of the guidelines on drug-resistant TB treatment. Now, due to our collective efforts and the latest update happened due to the latest evidence available, we have 3-4 times shorter treatment options without injectables, with much more effective new drugs and better treatment outcomes. This is really remarkable, and that's why jointly with Director General, you've requested member states to update, to implement them as soon as possible. Another example of joint actions, again at the high level, urgent call for actions to stop preventable death and suffering due to tuberculosis and recover essential TB services during COVID-19 pandemic. multi-sectoral actions and accountability becoming innovative mechanism instrument to address multi-sectoral nature and heavy social dependence of tuberculosis. So we are working together, and these tools were developed again with the direct contribution with specific chapters and annexes developed by civil society task force. Now we are working together on its adaptation and implementation at the country level. Here are a few other examples, but already examples of successful collaboration at regional level, and the European region demonstrate multiple actions where civil society representatives are involved directly and effectively contributing. We have also examples in African region, Western Pacific region, but we have to do much more, and we will see quite fast benefits from this collaboration. Civil society task force members are participating in all high-level events and critical meetings. The latest one was STARK TB. There have been several calls, including call for actions to accelerate efforts on TB prevention, including TB preventive treatment. We had a side event on the margins of the United Nations General Assembly, multiple webinars, again with a visible role of the civil society. We would like to remind you importance of the civil society hearing during the preparations to the first high-level meeting in 2017, where key asks has been delivered by the communities and reflected in the political declaration of the first meeting. Now we are looking forward to the next high-level meeting in 2023, and again expecting a very close engagement of the broader community, not only those who are now here with us representing, but also the audience who has connected, when we know that there are more than 500 participants already with us. Another example was progress report, which was presented in 2020 with the chapters developed with the support of the civil society task force members representatives. Brief summary of numbers can highlight the scope of your work, your efforts. High-level highlights of our main achievements, joint achievements. More than 30 new and updated TB policies and tools, including in digital format, has been developed with your direct contribution. All high TB burden countries provided by support through special community-led activities. 8 high-level events with the ministers, UN and WHO leadership, more than 100 thematic and technical webinars with your participation, more than 30,000 young people engaged in the fight to end TB through our joint initiative. So, but we should not stop. Of course, still there are a lot of critical gaps, including funding gaps in research and innovations, and it means that we have to continue move forward together. And we are looking for the high-level opportunities. We are looking also how to support countries to restore TB detection and drive down TB death. We are looking how to interact more effectively with the other UN agencies and partners, and how to urgently prioritize research and development for new TB vaccines, and building on lessons learned from the COVID-19 pandemic. So thank you very much once again. Looking forward to continued collaboration, and I'm sure we will make difference.
Thank you so much, Teresa, for that overview and for inspiring us always, and for your very proactive leadership and the efforts to end TB and your continued support to the civil society task force and affected communities. We do appreciate it. I'd like to now ask our greater support, Lana, from the Secretariat, to run us through some housekeeping and ground rules, and also share on the screen the terms of reference before we go into the sharing from the Civil Society Task Force. Thank you.
Thank you, Blessy, and greetings, everyone. Thank you very much for connecting to today's town hall. Just to highlight again the objectives of the town hall, we are here to, communicate a little bit about the task force priorities and achievements to date, as well as to, consult with the broader civil society and affected communities on what could be additional priorities that the task force to take on in order to better serve the needs of affected communities. We also are looking forward to everyone's inputs on how we as the task force can engage better and more systematically with the broader civil society and affected communities. So, as you know, we will be together until 4 o'clock CET this afternoon. We will focus now going forward we will have 2 presentations from our task force colleagues, which will aim to highlight task force achievements as well as the work plan. And then after that, we will have time for open discussion, inviting questions and answers with the use of Slido through an interactive session. So thank you very much again, and without further ado, back to Blessy.
Thank you, Lana. I just want to share, I come from the country of Gandhi, and one of the things he said was, in whatever you do, keep the face of the poorest and the most vulnerable before you, and you will never go wrong. And I think for us in TB, at least for me, I keep saying, keep the face of the person affected by TB, struggling, poor, lack of services before me, and one can never go wrong. So the Civil Society Task Force has been doing a lot of things, as you will see from the report as well, that colleagues from WHO will share for you all to have a look at. And we would like to hear from our colleagues on what we have done and what our plan has been. And but before we do that, we'll quickly go over the terms of reference for the Civil Society Task Force. If we could have that on the screen, please. So the Civil Society Task Force functions. One main area is translating WHO TB policies and put them into practice to make it something that is understandable at the ground level, and to mainstreaming the voices of communities that are affected by TB at the global, regional, and country levels. And for this, it needs an understanding and unpackaging so that it's easily accepted. The second one is catalyzing greater collaboration. And I just want to, kind of highlight that this collaboration that we have been looking at is like a well-oiled machine. Every part, starting from the top to the bottom, has to, function well so that the machine can run. And this is a very good example at that. And I think this is what needs to be replicated in all our initiatives that have anything to do with TB, whether it is the national TB programs, WHO country offices, regional offices, because our goal, as even Teresa said, is the same. We all want to end TB. Dr. Tedros also said, we don't want to see people suffering from a disease that can be cured. So catalyzing greater collaboration is extremely important. And then contributing to the implementation of WHO TB policies with particular focus on multi-sectoral action and social protection. And this is what CSTF has also been focusing on in our own regions, countries, to make it a reality. Advocating for inclusion in national TB strategy, plannings, social programs, ensuring that people affected by TB are not left behind. Next one. And nurturing strong linkages between the community-based actors and national TB programs. This can be a challenge at times, but we have been trying very hard to do this. And demand generation is something that is very important, because anything that is developed, if there is no demand for it, will be of no use. So this is a comparative advantage that civil society and affected communities have to create that demand from the ground level. And developing framework for monitoring and evaluation of collaboration between civil society organizations, national TB programs, to ensure that the contribution of the civil society gets formally introduced into the reportings is very important. And then capacity building. Not all civil society and community members are at the same level. They need capacity building. And this is another area that civil society task force looks at. And then, of course, a very strong push for increased domestic funding and other donor commitments for the TB response. Just as Dr. Tedros mentioned, we have done and we will continue to demand very strongly for increased resources, because you need to put your money where your words are. Otherwise, it would just be empty words. So with that, I'd now like to call on my colleague, Jamilia, to talk a little bit about our achievements and successes. Thank you.
Thank you. Thank you, dear Chair and Dr. Tedros. Dear colleagues, let me I'm thinking probably I will go quickly through the slides to present you the achievements and success made by Civil Society Task Force on TB so far. Why quickly? Because Dr. Teresa did it so well. She already presented all our main achievements. Probably almost nothing left to me, but I will go just through some of the achievements. Thank you so much, Dr. Teresa. It was really great to hear from you about our achievements. So I'm presenting this on behalf of our team.
But it's good we didn't agree before. It means that we're aligned.
Absolutely, yes, yes. So as you already heard, the Civil Society Task Force on TB was established in 2018, and with a mission of acting as a platform for dialogue and exchange to harness the potential in community and civil society engagement and accelerate progress to end TB. So we are 15 members representing all the regions around the world, and we were selected as a members by the independent panel. If somebody is interested how it worked. Yeah, you saw the pictures, but you also can see all my colleagues here around in this room, and they already introduced themselves. So we have prioritized 6 tasks, priority tasks for our CSTF, which is aligned with the work plan that we developed for like 2 years work plan, 2021, 2022. And those priorities, the first is like our operations, how we would plan to operate, being, as I said, representing around the world, but acting as our own capacity as an expert in this in the task force. And the second priority is accelerating the progress on the UN Secretary General's 10 priorities. Next one, ensuring meaningful engagement with WHO at all levels and boosting engagement with national programs. strong engagement in TB guideline development and research at global and country levels, engagement in a multi-sectoral accountability framework on TB processes in all levels, and innovation and civil society engagement in COVID-19 and TB responses. Next slide, please. To present the achievements made by the task force so far, 10 or 15 minutes is of course not enough. It could take days, but the good news is that we already have 2 progress reports that were published by WHO, and it's available. You can find it on the website, which has the details on our main achievements made in the global, regional, and country levels. Next slide, please. Here in this slide, you see it might look a little bit complicated, but what we wanted to show here that the task force, as Dr. Teresa said, I really liked it. We are in all WHO businesses. We are represented in all main areas, interventions such as in high-level advocacy and engagement, actions on COVID-19, mainstreaming civil society voices, multi-sectoral engagement, and policy development. So the members of CSTF are engaged actively in all these areas. Next slide, please. Here, it's already also mentioned that CSTF did contribute to the UN Secretary General 10 priorities like report on TB, and we specifically were actively involved in finalization, provided input in the final 2020 UNSG progress report on political declaration on TB, and section B, paragraph 61, 64, and 68. We have made a very actively and important contribution into this document. Next, please. Dr. Teresa and Dr. Tedros already mentioned about the CSTF engagement and contribution at the higher level. So here it's worth to mention that our representatives being represented at the STAC TB group, the task force members actively involved in the and contribute in different international days, not only the World TB Days engagement, and here it's also important to mention the joint statement with the Director General. Where the next slide, please. We are very thankful, and we really appreciate this support from Dr. Tedros to be with us and really support on almost all our asks that we had so far for Dr. Tedros. They were addressed and supported. And here the example of joint statement that already again were mentioned that we had before, and we used it really as a very good political instrument at the country level to push and support the countries to implement the and roll out of full oral regime treatment regime for DRTB. And we really hope that soon you will hear from us on the second joint statement jointly with the Dr. Tedros. So the next slide, please. The CSTF members are actively engaged in all process of guideline development and revision. And as already Teresa mentioned, regarding more than 30 guideline document. We here included like the 10 biggest, the important. All of them are important, but this is the the main TB guidelines and our contributions. And also would like to mention that we are really thankful to WHO that we had suggestion include not only the CSTF representative into the guideline development and revision group, but also representative of affected communities, and it was supported, and thank you for this. So they're also included. Next slide, please. The CSTF had and has a big contribution into the development of the multisectoral accountability framework and its implementation at the global, regional, and country level. And our one of the main contribution was into the Annex 2 of this framework, like the civil society engagement and the implementation at the country level. We are actively engaged. You can see in the slide there is some countries listed where the members actively engage in the implementation of the MAF-TB, and in the regional level in 12 countries, Western and Central Africa, and also in European region, in 5 countries of European regions, we are actively involved in implementation of the MAF-TB. Next slide, please. As additional highlights, would like to mention here about the CSTF being, again, like we are represented almost in all businesses of WHO. So CSTF also represented in WHO Civil Society Commission that was established just recently. We also, the WHO guidance document on TB and COVID-19 includes civil society task force on TB input. And with close collaboration, we have close collaboration and community-led evidence during on the impact of COVID-19 on health services. We have internationally involved, but also we have good examples of involvement, engagement in Brazil. I think this was my last slide. With that, so I would like to say thank you so much for taking this opportunity. Again, thank all of our team member, the Civil Society Task Force, being active at the country, regional, and global level. And of course, thank you so much, Dr. Tedros, Dr. Teresa, and WHO team for your support. Thank you.
Thank you so much, Jamelia, for that. Now to present the 2022 work plan of the Civil Society Task Force, I'd like to request Shamron on behalf of the CSTF to present this.
Thank you so much, Madam Chair. And on behalf of Paran, which is one of the partner for supporting, presenting the work plan and preparing the work plan. So let me try to walk you through some of the work plan for 2 years. But actually, as like Jamila mentioned, some of the activity that proposed in our 2-year work plan have already been achieved, and Dr. Teresa also mentioned a lot of those results. So this is a kind of a joint effort made by a civil society task force. So I just want to remind, please next slide, please. So the task force work plan for 2 years, in addition to our ongoing operation as a task force, we focus on 5 aspects. One is looking at political declaration and UNSG 10 recommendation. And second, focus on systematic engagement with WHO at all levels. And third, the third focus is on consultation in all policy and program development and research. And focus number 4 is about strong civil society engagement in mass implementation and monitoring. And the last focus is on mitigation of impact of C19 on TB services and progress. So let me try to highlight, even though we have achieved most of the results over the past 1 year and the middle of 2022. Next slide, please. So this is what we are going to do based on those work plan for 2 years. Under the operation, civil society task force operation, our highlight on that is systematizing use of social media, looking at how we can better profiling the work of civil society task force through civil society task force hashtag, yearly progress report and monthly call monitoring level of engagement from information sharing to meaningful partnership. And on the political declaration and UNSG 10 recommendation, in our work plan that we need to do for 2 years is looking at new indicator for tracking community and civil society engagement that will be part of new WHO strategy for community engagement in TB care and prevention with input from civil society task force. And the next one is around data on new indicator that will be collected and published. So next slide, please. Concerning to systematic engagement with WHO at all level, our activity that to be highlighted and share with you all here is about include civil society task force input into one is concerning to the revised WHO guidance on national strategic plan development and toolkit. And second, our input into the new WHO guidance on programmatic review. And the second activity concerning to this focus is around regular engagement with WHO regional offices and existing network. And the last one under this focus is engagement with civil society group focusing on TB determinant and comorbidity. Concerning to the focus, the next focus on consultation in all policy and program development and research, our activity which include engage civil society in a selection of community representative on WHO TB related research committee as well as at GDG. Raise feasibility of community-led research and innovation. Next slide, please. Concerning to our focus on strong civil society engagement in mass implementation and monitoring, this include civil society task force will contribute to the plan how to, must be tool and the case study. And the next activity is about civil society task force will provide input in the revision of civil society and Act 2 to the must TB baseline checklist. And the last one of our focus, part of the 2-year work plan, is the mitigation of impact of C19 on TB services and progress. And this include civil society task force will engage in evidence gathering on innovation to scale up, as well as to sustain effective practices of civil society and community. And next slide, please. And this is the last one. I just only part the rest of the year, the work plan for 2 years. And this is what we need to do as part of the crucial year is first, we have six actually a way forward that I have to do as part of remaining year. Looking at civil society hearing and UN high-level meeting on 2023. Second, development of W guidance for engagement of community and civil society to NTB, which also aim of its finalization in December 2022. The third priority that we need to do for this second year is engagement with WHO Civil Society Commission, which DGs also mentioned about that too. And number 4 is about new civil society mandate and membership post 2022. And 5th, nurturing close collaboration at global, regional, and country level. And last one of our priority for this year is boosting national responses, which includes civil society engagement in strategic level, mass TB, national strategic plan implementation, addressing TB commodity and determinant and M&E. Next slide, please. Yeah, I think that's all. So thank you so much.
Thank you very much, Shamroon. No time to lose, indeed. We do need to work hard. Thank you. Now for the next session, we are getting.
I have to go for another meeting. So if you give me 2 minutes, I have something for task force members. Yeah. So I will start with Blessina. What this is? It's a weapon.
Too cute. We promise not to use it here.
Okay. Julia? So the task force members, you tell me. Okay, you can come. No problem. It's a weapon.
Shamroon?
Thank you so much. Thank you.
Jeff?
Thank you.
Paran? Roger?
The last one to get something
Yeah.
special.
Tenzin? Amu?
Thank you.
And Jamilia.
Give the bags.
The bags.
Thank you. Thank you.
Who
Thank
did
you so
we
much.
miss? We didn't miss anyone.
Some people virtually participate.
Yes,
Yeah, we have
Okay.
some people virtually.
Yes. So for the virtual, we will
Yeah, we
send
can
them.
send to them.
We can send them. So with your permission, yeah.
Yes.
Thank you so much. Very glad to have you and look forward to work with you even more closely because we have a lot to do. We're just starting.
There are people who are asking questions. If there are anything specific for WHO or for you, we will direct
Okay.
them by mail to you and
Okay.
let you know.
Thank
Thank
you.
you so much, Dr. Tedros.
Namaste.
Okay, we are getting some questions from people who've joined us virtually. And I think one of the questions is on country level engagement with the civil society task force. And I think the best way for that is for people who want to engage with at the country level to email Global TB Program, mentioning which country, and they will direct you to the civil society task force member in that country and link you up. But we also have some very exciting new technology based session now where we're going to get inputs and your thoughts on two main questions about how CSTF priorities can better address the needs of the affected, and also how CSTF can engage more. And for that, I want to call Monica, who's also another part of that well-oiled machinery and has been a great support to us, to lead us and take us through this session. Monica, thank you.
Thank you so much, Blessy, and greetings, greetings, colleagues. I'm Monica Diaz. I'm with the World Health Organization Global Tuberculosis Program, and I lead the work on the DG Flagship Initiative, Multi-Sectoral Accountability, TB Elimination, and Public-Private Mix. It's really good to see the engagement, of course, here in the room with the town hall, but we're very excited to see the hundreds of people who are participating virtually. Welcome, as well as those who are participating by watching the live stream link on YouTube. So now what we'd like to do is we'd like to take the opportunity to hear your voice as well. And as Blessy has already shared, we'd like to hear your perspectives on two issues. The first one is you've heard already from us on the work that the Civil Society Task Force is doing so ably and how it's engaging, but we want to hear your perspectives going forward on how can the Civil Society Task Force priorities better address the needs of affected individuals and communities. And we'll come to the next question later on how CSTF can engage more closely with the broader civil society and affected communities. Now, I'd like to invite you to join us and share your perspectives on Slido. This is a new platform that we have. It's very simple. You take your phone and you point the camera at the QR code, and it will show you a link. You click on it and you will come to the poll that we have. So we invite you to do that. If you are connected by phone and you cannot do this, we invite you to type down www.slido.com and use the password #CSTF_TB. So if you could kindly do this, we are waiting for you to join, and we'll go to the first poll. So if we can proceed. Okay. So we invite you again to please connect. It's really simple. As I said, www.slido.com. And we have the first question for you. Going forward, how can civil society task force priorities better address the needs of affected individuals or communities? We'd like to type your answer, Please add in your name in your response. If we have the time, we would like to call on you to elaborate on your response. So if you can please type your name next to your response, that would be great. Wonderful. We can already see people posting. Yolan Andrews has posted, more efforts need to focus on case managing TB treatment. Okay, need for TB vaccine and CSTF. So again, a reminder, this is about how the civil society task force, how can their priorities better address the needs of affected individuals and communities. As you've already seen that the task force is very involved also in the research agenda. So this is great about the TB vaccine. Oh, we are seeing 14 participants are typing right now. Please do post your responses, add your name in. Okay, country consultations with people affected by TB from Olaide Akani. Kate says, giving survivors or community more and more ways to have meaningful engagement with decision makers. Okay, so please do post your ideas. Regular surveys to update needs of communities by Gilles. Funke, good to see you. She says, access to quality and affordable TB care. A need to scale up advocacy for TB preventive treatment by the task force. So the task force is getting a lot of suggestions. So psychosocial support. Karen Husselman says more engagement on childhood TB, a special commemoration on children and TB, more means of getting affected communities, participation. Okay, so this is all very good, and I'd like to take the opportunity now to ask. Let me see who can. Let's start with our the person who has posted very first, Yolan. Yolan, I'm going to allow you to speak. So if you can open your microphone and if you could just elaborate on your point, we would appreciate this. You said the need to focus on case managing treatment. Yolan, would you like to speak, please? Yolan?
Hi, thanks. Sorry, I just had to unmute. Thank you very much. I think that primarily what our concern is that we are seeing, perhaps not necessarily the great move in terms of starting a treatment, but more than expected. But in terms of actual completion of treatment, this is one of our biggest concerns. And we're not only just referring to TB treatment itself, but also TBT for those that should be on it and actually should stay on it for quite some time. And our concern lies in the gap in terms of case management of those patients, where perhaps the lack of psychosocial support, the lack of perhaps daily or weekly follow-ups to ensure people are taking their treatment for the period that they're supposed to take it. Also looking at the structural issues about why someone would not complete the treatment and having that support available to them, such as, for instance, the case of people prioritizing, income generation as opposed to going to clinical visits or taking their medication, etc. So I think that, if we are going to make strides in terms of curing TB, we really do need to look at what is the support that's required on the ground to ensure that people are completing their treatment. Yeah, thank you.
Thank you so much, Yolan. I think those are great points. We'd now like to go to Kate. Kate, I have promoted you to panelist. If you could come online and also go on video and elaborate on your points here from VRTB on giving survivors a community more and more ways to have meaningful engagement with decision makers. How do you think the Civil Society Task Force can prioritize this? Kate.
Yeah, and I think task forces like this are so great, but it just more and more ways for people who have had personal experience with the disease to just connect not only with people who are involved in TB care and treatment, but also maybe people who decide funding and more connections. Just more and more places where they can talk about their experiences and the need for more funding and the need for care to be person-centered. I just think the task force is in a great place to just put people who have had personal experience with the disease in more and more places where they can be heard.
Thank you so much, Kate, and also thank you. We know well your advocacy as well on this issue, so a lot of appreciation. So thank you. So we have over 30 responses already. We're going to keep that poll open, but we want to hear more. We are running out of time, so we want to get your perspectives on another question. So if we can go to the next poll, please. We are going to open another poll, so stay connected. And those who are not connected, use your cameras for the QR code or join us on slido.com with the password #CSTF_TB. And we'd like you to answer the question, how can the Civil Society Task Force engage more closely with broader civil society and affected communities? So we really want to hear your voice on how the civil society can engage more broadly. There were a few questions already in the chat around this. Here is your opportunity to make your suggestions. So we invite you to do that. Okay, so it's good we see people. Please add your name so that we can call on you as well. Okay, so we're already seeing ideas, organize regional or country consultations, similar to this town hall at regional and country level. This is a very clear ask, working very closely with regional and country offices. We are very happy, as Teresa, I think, shared at the beginning, we have our colleagues from our regional offices here in the room. So they are also taking note of your suggestions. We have strengthening TB champion groups and affected communities. Dr. Mboya, so I'm going to promote you to panelist. Dr. Felix Mboya, if you could come online and speak. So while Dr. Mboya from ECPAF tries to connect, we also see other things, the use of clinical committees in countries where they're available. Joel, Dr. Mayova from Nigeria says, engaging with civil society and communities delegation. So let's go back now. Dr. Mboya, I see you are now a panelist. So while others are posting, if you could elaborate on your point. Dr. Mboya?
Yeah, thank you very much for giving the opportunity to elaborate my point. I know that the strategy which I've seen is really working across the civil societies is the involvement of the TB champions. And these champions work closely with the communities in terms of involving in case identification and also help in terms of reduction of the catastrophic effects in terms of bringing medication closer to the community, especially those who could not manage to reach the facility, especially in hard to reach areas. And the champions themselves has a knowledge on how to advocate for uptake of services within the community. And I think this, if broadly introduced and the affected communities would really be good, especially I would go also within the level of where they could be having some community-based meetings with the affected communities and getting what the communities need in terms of TB priorities. This would be very, very important. I think in summary, that's what I was taking. Thank you, and over.
Thank you so much, Dr. Mboya. Very clear ask. We appreciate this. We also see another comment, which is quite good. We have several, actually, several great ideas. So we have Russell Rensburg, who says greater involvement and support to activists to better integrate TB into universal health coverage. So we had our Director General here. We have our Assistant Director General who leads the work on UHC and non-communicable diseases. And so it's definitely a priority for us. Ending TB is very much a part of UHC. So over to you, Russell Rensburg. I've promoted you to panelist. If you would like to open your camera and elaborate on this.
Yeah, thank you very much, and thank you for the opportunity to share our comment. Look, I think really we need to be a little bit much more specific in the fight against TB, and linking it to universal health coverage allows us to use the existing data, understand better where there are lower levels of effective coverage for TB in a particular country or community where we work, and then develop strategies that set out targets against achieving effective coverage. In South Africa, despite some significant investments over the last 10 years in both HIV and TB, We're currently only sitting at 56% effective coverage across most districts, and in some of our more rural districts, coverage is much lower. But when we invest in a one-size-fits-all. So now one of the benefits of COVID is that we have better data tools, and we need to start integrating those data tools more effectively in how we advocate for effective coverage of TB and to end TB in our lifetime. Thank you. Over.
Thank you so much, Russell. That was really very helpful. So we have a few more ideas that have come up. I'd like to call on Paul Sommerfield. Paul, you suggested connecting with regional networks. So would you like to elaborate, Paul Sommerfield? Okay, so unfortunately, there seem to be technical issues. Apologies for that. Maybe you could mute and unmute again one more time. Okay, unfortunately, we are having technical issues and we're also running a bit out of time. So what we'd like to do then, so unfortunately, so Paul, we'll come back to you. Please do post your ideas on the chat or the Q&A. So first, thanks to all of the colleagues for posting these suggestions. The Civil Society Task Force has taken note of all of these. Now, what we'd like to do is we'd like to take a few minutes now to basically rank these priorities. So we've been noting all of these priorities that you have provided on 2 areas to better address the needs of affected individuals and communities, as well as on how the CSTF can engage more broadly, right? So now what we're going to do is we're going to ask you to basically rank what you see is the top priority using Slido. So now let me go back again. Let's see if we are ready. And we'll ask you to again rank among these what you see are the top ones. So all of this is happening live. So thank you for your patience. You've just typed in your responses and we're trying to try out a new poll. Thanks to my colleague Wongi, who's coordinating on the side. Okay, great. So Paul Sommerfield, who had technical difficulties in speaking, has written to one of our Civil Society Task Force members. Will write. So thank you, Paul. He will write and we will definitely note this down. Thank you. Okay, so now we're going to go into a ranking poll. Again, please stay on Slido. And we will share it in just a second. Okay, now here you can see a list of all your suggestions. We'd like you to go through it. Of course, there are some which are repetitive. We'd like to invite you to rank these to see. So if you think, having more TB champions on board is one of the top priorities, please rank that. Rank your top 5, basically. So don't rank all of them, but of course, everything is important. Try and rank your top 5 so that we can have an idea of what you see as important. Again, you can use the QR code to log in and to rank to see what you consider important. What are your top 5 priorities among all of these suggestions? And many thanks to you all. These are your suggestions that we are asking you to rank. Okay, the ranking has begun. Okay, so the top one, if you can go up a little. Okay, so communication approach on stigma. All right, so the top one that we're seeing is really these regional and country consultations. We are asking our colleagues at regional and country offices to work with us on this. Stigma also is featuring right on top, collaborating with regional civil society networks, holding regular webinars to unpack the WHO guidelines so civil society organizations can understand better, engaging civil society in affected communities beyond service delivery, and empowering CSOs. Now, we're going to keep this open, and I'd like to take the opportunity to thank you all. It's really been excellent, the level of collaboration. You've given us a lot of good suggestions that we're going to take on board. I will now pass back to our Civil Society Task Force Chair, Blessina Kumar, to reflect on these top priorities and take us ahead. So back to you, Blessy, and thanks, dear. Thanks, everyone.
Thank you very much, Monica and Yi, for that amazing technology wonder where we could hear from so many of our colleagues. Big thank you to people who joined us. And I really feel that you've validated us. You've given us ideas on how to take this forward to the country level and make it a reality at the country level. I want to thank you for your support in helping us, formulate our plans in moving forward. And all of you, the civil society and communities at the country level, are a major stakeholder in ensuring that our voices are heard loud and clear to the highest level so that we can do the best that is possible for people who are affected and suffering with TB. So once again, thank you very much for that. And it was such a rich discussion, and hopefully we'll have more opportunities to do this. I'm very excited about one of the suggestions to have similar town halls at regional and country level. And we'll look to the Global TB Program for your support in reaching out to regional and country offices to make this a reality. So thank you very much for that. Sadly, that brings us to the end of this very vibrant and rich town hall we've had. But in closing, I think, we have taken, starting from the commitment of the DG for the work of civil societies and communities, such a, obvious and real commitment that he has expressed and he has committed to. Till today, he has not said no to the civil society. Everything we asked, he has actually agreed and supported. So it's a great opportunity for the global civil society to take this opportunity and move forward. And we've also seen the commitment from the leadership as well, from ADG and from the director of the Global TB Program. So it's a great start for us to really work hard, especially now that we are preparing for the UNHLM. I think it's a great start, great opportunity, a great space that is available. And we need to take this and move forward. And now I'd like to invite another dear friend of civil society, Farai, who is the unit head of vulnerable populations, communities, and comorbidities at the WHO Global TB Program. Farai, if you would like to say a few words.
Okay, thank you. Yeah, so I don't have much to say, just to acknowledge and thank everybody for their contribution during these discussions. The panelists, the moderators for the sessions, the presenters, all the facilitators in the background. We have been supporting this session for it to run smoothly. We do apologize. I think we failed to get one or two speakers online due to technological glitches, but I hope you managed to make your submission via the Slido or the Q&A function. We also want to thank everybody who managed to join this session, as well as those from the WHO regional offices who are also here, who've been listening into these discussions. So we will take these discussions forward. We will take the inputs that we've received in these discussions to shape the work of the Global TB Program in collaboration with the Civil Society Task Force to advance the TB agenda and strengthen community engagement going forward. So thank you so much for your contribution. I will now hand over to the director, Dr. Teresa Kaseva, to close the session. Teresa.
So thank you very much, dear colleagues and friends. It was the excellent event, the discussion, and the purpose of this meeting is, of course, not to celebrate our achievements and acknowledge each other. Of course, we value a lot all our work and contribution, but still there are too many sufferings and death. People from preventable and curable disease, and also due to ongoing conflicts and in many regions. And that's why we can't celebrate. But I believe that if we will continue working together, there will be such a moment quite soon. Everything is in our hands. But the purpose of this meeting was to share with you, with the broader audience, our experience of work together, to present some clear examples and results of our work, and also to demonstrate that collaboration with civil society is WHO true priority, not verbal, but confirmed by some concrete steps. And we would like to encourage you all work closely, and you will see real benefits from this collaboration. It's not the end, it's just the beginning of our journey to be continued, and we'll be happy to hear your feedback, your proposals, how we can improve, and there is always space for the optimization. Please remain committed to NTB. Please stay with us, remain healthy and safe. Thank you.
Thank you very much, Dr. Teresa, for those words. In closing, I'd like to thank everyone once again who joined, and my colleagues at CSTF for a great town hall that we've had. So let's go and end TB together. Okay.